أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم Assalamu alaikum wa rahmatullahi wa barakatuh. It gives me immense pleasure to welcome you all to IOU's first ever online conference, Solace 2015. This is the last session of the second day, and the topic for this session is Effects of Trauma on Children. The session would be presented by Dr. Fahad Khan. Before I hand over the session to Dr. Fahad, let me introduce him to you all. Dr. Fahad Khan is a licensed professional counselor, holds 2 master's degrees, and has completed the requirements for his doctorate in clinical psychology. He is also a Hafiz of the Quran and has studied Islam with various scholars in the Muslim world and the US. He also serves on the editorial board for Muslim World Affairs, an online journal. He has conducted research studies on help-seeking attitudes of Muslim Americans as well as the effects of religiosity on psychological distress. He is currently the Deputy Director at Khalil Center, a Muslim community mental health center near Chicago, United States. Now I request Dr. Fahad to please take the mic and start the session, inshallah.
Jazakallah khair for giving me this honor to present to everybody here, alhamdulillah. The topic that was, when I was given the options, I chose this topic because of several reasons, and I want to go briefly into those reasons before I begin, inshallah. The first reason was that when I did my internship for my doctoral program, I worked primarily with children who are negatively affected by trauma. And also throughout my practice, I have worked primarily with adolescents and children ages 12 to 21. And one of the main issues that I see whenever I'm provided a case, to oversee and to deal with, say for example, a 15-year-old adolescent boy who's acting out, the parents will bring them in and ask me, what's going on with my boy? Can you help us out? I always, when I do my assessment, I assess for several things. If the child is having the issue only at home and say he's not having the same problems, the same behavioral concerns at school, then one of the first questions that I ask the child is, are your parents fighting at home? And believe it or not, I want to say, 75 to 80% of the time, what we notice is that there's a lot of fighting going on in the house because of poor marital relationship between the parents. And so that negatively affects the child, and the child, or the adolescent in this case, will then start acting out, in manners that just seem very odd to the parents. So that just goes to show the effect that trauma can have on children. And I know if we study the physical sciences, a lot of times the doctors will tell you that children are very strong. Alhamdulillah, they have a very good immune system, which is true. But however, if we look at their psychological functioning, and if we look at several different theories that are out there as far as development is concerned, we notice that children develop, at a very steady pace. And according to some theories, development continues on in the 20s and 30s and even beyond. So any kind of negative effect, whether it's trauma or anything else, on the child will leave a very deep mark for the rest of their life. So it's very important to understand. So the take-home message, hopefully, from this presentation today will be, what trauma is for children and how it comes out. So if you're a parent, hopefully you can work on making sure that you're protecting your child from that traumatic experience. And if you're a clinician, hopefully you will see some behavioral changes or significant issues that you may see among children that have been traumatized. So we'll continue with that, inshallah. So first, to begin, obviously, to understand what trauma is. Now, it's been identified as the emotional, psychological, and physiological residue left over from heightened stress that accompanies experience of threat, violence, and life-changing events. So as you can see, the definition is very broad and very detailed. In brief, if you have to define, you can say it's a more overwhelming event than a person would ordinarily be expected to encounter. So for clinicians, when we do our assessment, the question that we often ask is, was there a time that was more stressful for you? Was there a significant event that happened where you felt maybe afraid or too stressed out? And that's how we begin to assess for trauma, especially with children. Now, it's good to remember that every child will react differently to traumatic experiences. Now, that's good to remember because not all children will have a negative effect of trauma. In fact, what ends up happening is that the majority of children are very resilient to the trauma. So you may have a child who has gone through a very traumatic experience, but alhamdulillah, he's doing fine. So that's something that is not a surprise. Now, it doesn't mean that you don't assess them for trauma. Say if there was a child who went through the recent earthquakes in Nepal. And so if you're working with the child, obviously you should make sure that that you're doing a full assessment to see if the child was negatively affected. But there's a good chance that he may not be. The reaction depends mostly on the developmental level, the pre-morbid functioning, how the child was doing before the trauma, any previous life experiences, level of exposure to the trauma, parental reactions, and any kind of changes that happen because of the trauma, especially living situations. So to give examples of that, if a child, alhamdulillah, has developed, very healthily, and the parents were able to help the child develop through their earlier phases in life, then it is likely that they may not experience trauma similar to others who went through the experience but had poor developmental experiences in the past as well. Okay, so now this is a very important slide to remember. Why it's important? Because a lot of times we don't recognize what trauma is. And when we talk about trauma, especially with relation to children, we think of like natural disasters and violence and, seeing somebody getting shot, and those kind of things, or being in a war zone, or being sexually abused. And you notice that those words or phrases are in the slide that's in front of you. However, the one that I want to point out to you that's oftentimes missed is the neglect, which is on the top right here. Neglect is also a form of trauma, and I will show you another slide later, which will talk about how neglect affects a child, not only psychologically, but also physically and physiologically. So it's important to remember that when we talk about different types of trauma, that it's not just only kind of violent, or abusive or traumatic event, but it can also be neglect, where the person is either physically or psychologically being neglected, especially by the primary caregivers. So complex trauma is when there's an exposure to multiple or prolonged traumatic experiences. Now, during my internship, when I was working on my doctoral degree, when I worked with children who went through traumas in their life, oftentimes there was a complex trauma. And so for a good example of that was, they were living in south side of Chicago, so there was a lot of violence, community violence. They were exposed to people getting shot, people dying on a regular basis. The murder rate is very high. They also noticed for most kids, the parents or the fathers were not around. They were either incarcerated in prisons, and mothers would go out and work, or if the fathers weren't around, there were some also domestic violence between parents. Then what ends up happening with some of these kids is that there is some sort of an event that happens in the house, and the government agency will go and remove the child from the home. So now you can see there's a whole bunch of traumatic experiences that are happening, and so that's where the term complex trauma is used. So it involves simultaneous or sequential occurrence of a child maltreatment. It could be including psychological maltreatment, neglect, physical sexual abuse, family violence, that is chronic and begins in early childhood, and primarily happens in the main caregiving system, the parents in this case. Now, these kids are the most difficult ones to work with because it's not just one trauma that you're working with. There's so many different ones that are happening at the same time. So it's very, very complicated, and you may have to prioritize which type of trauma you want to work with first, depending on the person and your theoretical orientation as well, inshallah. Family violence. So that's actual or threatened physical or sexual violence or emotional abuse. And now this can happen in a way where, say, parents are fighting one another, or parents are physically beating or abusing another child, and this child that you're working with has been exposed to that kind of violence. It could also be a direct violence from a family member, say an uncle, or even sometimes, na'udhu parents also sexually abusing or molesting the child, so where the family is involved. Medical trauma. So that's a reaction to pain or injury or a serious illness or to any kind of invasive medical procedure like a surgery or treatment like, say, a burn cure, and that can be traumatic as well. To give you a clinical example, I worked once with a physician who was having a surgery done, and he had to go through anesthesia. And when he came out of anesthesia, he was having panic attacks, and he wasn't sure why that was happening. And so, when we did a thorough psychological intake, we found out that most likely reason for that was the anesthesia itself, that it turned out to be a very traumatic experience for this individual. Natural disasters. Now, we all know about the earthquake that happened in Nepal and other natural disasters that happen all the time. So these are reactions to pain, injury, serious illnesses, or to invasive. Actually, that's looks like this is the slide. There's a error in there, but these are disasters that happen, and so the child or the person is observing that, an earthquake or people dying or people getting killed, and that has a very negative effect on the child. Okay, so community and school violence. This is something that's becoming very common, even in developed nations. I live in Chicago, and so I have worked with children who live in Southside Chicago, as I mentioned earlier. And a lot of these children are exposed to these kind of examples, like predatory violence, some kind of robbery, any kind of violence that may come from personal conflicts between people who are not known to the child. So, for example, gangs. And gang wars, when two gangs are involved in shootings or killings or beatings of one another, and a child is exposed to that, that can be traumatic. If the school has an environment where that's not conducive to the safety of the child may be exposed to either seeing fights between other individuals or being part of a fight or getting bullied or threatened or injured as well. And that's also a traumatic experience. Neglect, as I said earlier, this is the one that, coincidentally and ironically is neglected the most. Neglect can mean a parent or a caregiver not providing food, shelter, clothing, or access to medical or health treatment. It can also mean exposing a child to dangerous environments, having poor supervision with a child, putting a child in the care of someone incapable of caring for the child, or abandoning a child or expelling a child from home. So as you can see, some of these issues are often ignored, and you may not see. I mean, obviously, if the food is being taken away from the child or the child is not being provided nutrition on time, the child will have physical effect and malnutrition. However, we have to also take into consideration the psychological effects that may happen with neglect, inshallah. Okay, physical abuse. This is causing or attempting to cause physical pain or injury, punching, kicking, hitting, burning, or harming the child in other ways. And it can consist of a single incident or multiple incidents. This is one of the ones that are a little bit more difficult to assess, especially when you're working with cultures that are Eastern cultures. And I say that because, it's very difficult at times to draw the line between what is considered abuse and what is considered, parenting, when you're just disciplining the child. And for me as a clinician, where I draw the line is that I look at how it's affecting the child. If the child is having any kind of negative effect, and we will see those effects later in the slides, and how behaviorally the child will portray, to you as a clinician. If that's something that we're seeing often, then we can say, and if there's no other cause for it, let's say that parents are just a little bit I guess, more disciplining than what's expected, then that's where you draw the line and say maybe physical abuse. And sometimes people are very rushed, especially in the United States, to make the call to the agency and report physical abuse or parental abuse. I always make sure I talk with the parents because sometimes parents don't really know, and they have not been educated, and they may just think that they're just in some ways disciplining the child and helping the child, but they may not understand that their discipline can cause some very long-term and harmful effects for the child because it's a traumatic event for the child. Sexual abuse, it includes a wide range of sexual behaviors that take place between a child and an older person. And some of the examples of the behaviors are given below. Now, this is something that's a lot of times very difficult to assess. And I will say that even as a parent myself, and knowing other parents, alhamdulillah, I have not had to go through that myself, but knowing parents who had children that were sexually abused, usually the child is not very easy to come out and let the parent know that I have been sexually abused. And the main reason for that is because the child is not aware of what sexual abuse is. I mean, if we're talking about a child who has not reached puberty, who has not been exposed, this child will not even understand what that means and what happened to them. And other times the child is threatened by the predator, the person who's perpetrating the sexual violence, will threaten the child, so the child already feels like, if he comes out and says something to the parent, that might be difficult. And so some of the behaviors, there's a lot of behaviors that you have to watch out for, but a lot of times children get involved in very odd behaviors, and those behaviors then can lead to an evaluation, which then turns out that there's indication of sexual abuse. And if it's repressed, it comes out later in life for a lot of the individuals and causes problems when they're trying to become intimate with their husbands or wives. Refugee or war zone trauma, obviously exposure to war, political violence, or torture. As we know, the term PTSD emerged from Gulf War syndrome, which was coined after the soldiers that returned from war portrayed some sort of symptoms, and so that's where the study of trauma kind of began significantly came under light. It can be a result of living in a region that is affected by bombing, shooting, or looting, as well as forced displacement to a new home due to political reasons. So, unfortunately, especially for Muslims nowadays, everywhere you look in the world, from Burma to China to Kashmir, India, and you go into the Middle East, into Syria, Jordan, and Palestine, and a lot of areas, including now even in the United States, that Muslims are constantly exposed to violence, and so they're kind of living like they're almost in a war zone. Even in the United States, a few months ago, we had 3 young college students that somebody came into their house and shot them, and primarily because they were Muslim. And so that's something that we have to be often cognizant of. And some people, not all of them, but some people may have some kind of a reaction to it, especially children, especially if they don't understand why it's happening. They don't understand the political atmosphere. They don't understand the reasons behind the action, so it may cause some negative effects in children. Traumatic grief is when there's a death of a family member or someone important to the child, and this death oftentimes is a sudden and unexpected, like an accident, or it could be even anticipated, like illness or other natural disaster. Now, we all know that when a person is exposed to death, there's a natural process of grieving that occurs. And there's a lot of research on it. I encourage people to read on this research and familiarize themselves with it, that every person will go through, denial, anger, bargaining, depression, and finally acceptance. Those are the 5 stages of grief that have been identified in the literature. But for children and even for some adults, people, even after they have gone through those stages, or they may be stuck in a stage and they may have not grieved properly, and they may end up causing some kind of a negative traumatic symptoms to emerge within their psychological functioning. Okay, so the effects of trauma on children. Children who experience trauma or horrible external events may experience emotional harm or psychic trauma. So that's how it affects them psychologically. If left untreated, all but the mildest of the childhood trauma can have an impact on the child. So it's a very sensitive topic. It's something that we have to be very mindful of and make sure that we assess important in a very thorough manner. It's important to remember that abuse, neglect, and other trauma have different impacts on different children. And that while we have to take seriously the negative impacts of trauma, we cannot underestimate the strength of human resilience. So as I mentioned earlier, most people don't have a traumatic experience, don't have the same response to the traumatic experience, but some of them have response, and even those who do have it differently. And the difference can be very different from their symptoms, their behavioral presentation, and even how, when you work with them as a clinician, how can that come out? And as a parent, how the approach that you take will depend a lot of times on that as well, inshallah. So this slide kind of shows what a normal brain looks like and the development that takes place. So as you can see, the cortex, which is the blue part, will develop between ages 3 and 6, and this part is primarily responsible for reasoning and judging. And if you go to the limbic system, which is this area right here that's responsible for emotional well-being of the person, that begins to develop at age 1 and continues on to age 4. So that's the one that we're primarily looking for when we're working with children with trauma, because that's the part that is affected the most. And also, if you look at other areas like cerebellum, which is the motor center, that begins obviously from birth, because kids are moving, whether they're able to physically move with their feet or not, but they're in constant motion, and goes for about 2 years. And then the brain stem, again, this is also another area that we're looking for when it comes to trauma. And interestingly, it starts to develop before birth and continues on to age 8 months. So by 8 months, they may have their survival functions already in place, and I'll explain in a bit why that's important and what that means for kids who have been traumatized. Okay, so this kind of talks again about as you may or may not know, the brain is divided between the left and the right hemisphere, and so between ages 0 to 2 is the right hemisphere developing, and it's important to note that the right hemisphere is primarily responsible for emotional functioning, where the left hemisphere is responsible for the logical functioning. So a person who's considered a right brain is often, the term that's used is the person who's very emotional. So that develops at ages 0 to 2. So, this is something, again, because we're not aware, we don't really take into consideration that children by age 2 have the capacity, the emotional capacity and the emotional understanding, that may be fully developed by that time. And so their temperament and the way they react to things and how we work with them, it may be that's a very crucial time. And so that happens starting at that time. And then, between 2 to 4, it's primarily left hemisphere development, and it goes back to the right hemisphere, and it goes back to the left hemisphere. And then by age 8 and plus, it's an integrated development between both right and left hemispheres. We talked about neglect, and this is what I was talking about earlier, how neglect can affect a child. Neglect is the absence of critical organizing experiences at key times during development. So, for example, initially if the child needs to be fed, neglect would be if the child is not being fed. Later on, if the child needs to be supervised, and if they're not being supervised, then that also means that they're being neglected. It can involve sensory deprivation in a number of domains, such as language, touch, and social interactions. And unlike a broken bone, maldevelopment of neural systems mediating empathy, for example, resulting from emotional neglect during infancy, is not readily observable. So it's something that you can't see it a lot of times with a child, that they are being neglected, especially if they're very young and they can't even speak and they can't let you know about their being neglected. But inside in their brains, there's a change that's taking place. And this is the slide that I wanted to show, and that kind of shows how neglect can really affect a child. And so as you can see, the entire brain, the left is the normal brain of a 3-year-old child. This is how it's supposed to look. And the right is the one who has gone through extreme neglect. Now granted, this is extreme neglect, but this is a good way to show the comparison between having a normal childhood and the one that has a lot of neglect. And so you can see overall, the difference between gray matter and the white matter, the cerebellum and the cortex and everything, and how that's different. And so this is where the psychological issues that emerge come from there. due to the brain changes that happen because of neglect. And this is a 3-year-old child, by the way. Okay. We're going to kind of switch topic a little bit and talk a little bit about how trauma tends to reverberate down the generations and shows a problem such as substance abuse, mental illness, family violence, and child abuse and neglect. So how that happens is, a lot of times these are learned behaviors as well as those that pass on genetically. So substance abuse, there's research that indicates that if the parents are smokers or alcoholics, that the child is most likely going to be an alcoholic as well, or will have a genetic disposition to being addicted to a substance. The learned behavior can be that the child grows up watching the father, drink or smoke, or the child grows up watching, the father being very strict and abusive towards the family. And so the child will take on those behaviors and kind of go on with it through their own adult development. So sometimes you see that those kids who were exposed to the trauma, whether it's abuse, neglect, or violence, or even substance abuse, they're more likely to do that, pass that on to their generations, and so on and so forth. Often it's accompanied by poverty, isolation, and physical illness, primarily because if you look at poverty, for example, alhamdulillah, Islamic Ahmad University is providing this beautiful conference where anyone from anywhere with internet access can come online and educate themselves. But mostly people are not educated. So a lot of times the first, the way to prevent these kind of things is to educate the people and let them know that, the effects that trauma can have on children. And problems are often found together, so it becomes a very complex issue and very difficult to deal with. Trauma experienced by one person will usually have a ripple effect on other family members as well, and mainly extended family members and friends. So like I said, sometimes these are learned behaviors. So for example, if a child spends a lot of time in a friend's house and he sees the friend's father is abusive, so you may not be abusive to your child, but if your child sees his friend's father on a regular basis being very abusive, then the child is learning that, and he may pass that on to his future generations, or that may cause a negative traumatic effect on him as well. And we already talked about the environment. So I want to skip because we're kind of short on time. So this is the slide that I wanted to. Okay, so placement disruption is one of those things. Now we know, of course, if there's a war, or as I mentioned before, in the United States, if there's any kind of indication of any trauma, and a child is oftentimes removed from home. And even if the child is not removed, if the parents move a lot at a very young age, that can have a significant effect on the children's development. So children who are removed from home, are separated from their parents due to abuse or neglect, have to undergo massive internal reorganization to a new environment that they're in, a new school, a new home, a new culture. And adults are very easily adaptable, but the children psychologically are not. So flight and fight response. This is something that happens, with the kids who are traumatized. So as you know, that our bodies will have two different types of responses at one time. So either we go through what's termed as a rest and digest response, or what's termed as a flight or fight response. And a flight or fight response is something that activates the sympathetic nervous system. And so we go through, our body go through this survival mode. And so this is a kind of example that's given. Jason has been abused at home. He's now living with his foster carers. He overhears his foster care arguing. Because of his previous experience, he's afraid he will be attacked. This sends his body into survival mode. In survival mode, Jason can either attack first to get upper hand, which is a fight response, run away to a safer place, which is a flight response, or stay as quiet and as still as possible so he isn't noticed. That's a freeze response. Now, these responses are kind of like like an animalistic type of responses that our bodies have, and so they happen without even any kind of any way to control them. They happen so readily and easily that the person may have not have any control over them, especially a child who doesn't have a full psychological function to begin with. So the impact of trauma on ages 0 to 12. This is the first age that we're going to talk about. The neurobiology of the brain and the central nervous system is altered by switch-on alarm response, which is what we talked about earlier. So if the child is exposed to trauma at that age, and this is the first year of life, then the child will learn to react with that flight, fight, and the freeze response. And there's some behavioral changes that also happen during that time. Either the child will cry too much or cry very little, and that's something to be mindful of. There's a regression in recently acquired developmental gains and hyperarousal, hypervigilance, and hyperactivity. So hyperarousal is basically when you're just over-aroused. Basically, you're and same with hypervigilance. You're just looking for something like something bad is about to happen to you. And hyperactivity is basically when a child is overactive. Also, you will see sleep disruption. So the child is not able to sleep. Normally, a child between 0 and 12, initially there's a short, brief periods of time where the child sleeps, but it kind of continues on to where the child should be able to sleep for, inshallah, 25 to 30 minutes. I mean, sorry, it starts from 25 to 30 minutes, and they progress towards being able to sleep even 8 to 10 to 12 hours. But if you see that they're exposed to trauma, they're going to have the sleep disruption. There's going to be loss of acquired motor skills. So these are skills that were already acquired as a child, like some kind of a grip response, and now you see that the child is losing that, and that could be due to trauma. Lowered stress threshold, so the child is not able to handle the stress. Lowered immune system, because trauma affects the brain, so the brain then will have a negative effect on the immune system. Fear response to reminders of trauma. So if the child is shown the reminder, so let's say the father is constantly hitting the mother in front of the child, every time the child will see the father, he will have the same type of response that he felt when he saw the parents fight one another. And mood and personality changes, like I mentioned before, crying, agitation, not being able to calm down easily. There's a loss of or reduced capacity to attune with a caregiver. So ideally, especially with the mother, there's this level of attunement. Alhamdulillah, Allah subhanahu wa ta'ala has created us in a way that we're able to attach ourselves with our mothers, and the mother is able to understand the feelings of the child and vice versa. But if there's a detachment, or there's a loss or a reduction in that, then that may indicate trauma. There's a loss of or reduced capacity to manage emotional states of self-soothe. A child at that age is able to self-soothe and even soothe through other means like giving a pacifier. But if the child is not able to do that, or if there's a reduction, that may indicate trauma. Insecure, anxious, or disorganized attachment behavior. There's a whole amount of research that is available on attachment patterns, and I encourage everybody to look into that research that was done by Bowlby and others. There's a heightened anxiety when separated from primary caregiver. So a child who is securely attached will have some anxiety, and then the anxiety will tends to go away after a little bit of time. But a child who is exposed to trauma will have heightened anxiety, and the anxiety will not go away over time. So that's the difference between a normal and a traumatic childhood. There's also indiscriminate relating between relationships. There's reduced capacity to feel emotions, and the child can often feel numb. Cognitive delays and memory difficulties may be there. And these are issues that are becoming now long-term. So keep that in mind. They kind of emerge if you're traumatized during that time, and they may go through the rest of their life. And there's a loss of acquired communication skills. So now we're going from ages 1 to 3 years. So this is beyond the initial the trauma. So if the person now is continuing to see the trauma and being exposed to it, how it can affect them negatively. There's an increased resistance to parental direction. So this is a very common issue, and this is why kids are oftentimes referred to clinicians that the child is not listening to me, he's not following directions, he's doing his own thing. I had to see a little girl one time. I think she was about 5 years old, and she would scream at the parents, and she would hide and run and hide under chairs and do very odd behaviors. And again, when I did a thorough interview, we found out that the parents had a very poor marital relationship, and they would fight a lot. And the dad, when he got angry, he would actually break things in the house, and so that had a very negative impact on the child, because the child was functioning very well in the school where the environment was not the same. The memory of the trauma may be evident in behavior, language, or play. So another example I want to share here is I was asked to see a family, where there was poor marital relationships and family was having some difficulties, and I was interviewing, and I noticed the youngest son, who at the time was about 4 to 5 years of age. He came to his mother and he started in his own language screaming something at the mom and pointing and yelling. And later we figured out that he was basically replaying the way his father yelled at his mother. So he had modeled the behavior, internalized it, and now he was doing the same thing that he would watch his father do, because his father had a tendency to scream at his mother, and that's something that the child watched and learned. We also see behavioral changes that happen. As mentioned earlier, there's the hyperarousal, hypervigilance, hyperactivity, loss of toileting. So, a child, usually the toileting age, or the age to teach a child how to go to the bathroom and use the bathroom, is about between ages of 3 and 5. So if they're exposed to trauma, you're going to notice that there's going to be a loss of that acquired skill. There's a regression that may happen, especially, say, eating skills. So the child was first beginning to eat on their own, and they get exposed to trauma, and now they're going back to being fed by their caregivers. Sleep disturbances and night terrors. So nightmares that are happening, and the child will wake up in the middle of the night screaming and crying because they may have had an experience in their dream that reminded them of the trauma. There's also a neuresis and encopresis, and neuresis is when the child begins to bedwet. So this is a child who has already been potty trained. He already knew how to use the bathroom, and so he's not sleeping with a diaper, but then begins to bedwet. And encopresis is basically, again, what's the term I'm looking for? Basically goes using the bathroom anywhere that you feel comfortable, even in the bed. And so the child is not only bedwetting, but he's also kind of pooping in the bed as well. And that's what encopresis means. There's delayed gross motor and visual perceptual skills. There's a fear of trauma recurring. So that's where the hyperarousal comes from, that the person feels like this is going to happen again. To say, again, going back to the previous example of the father beating the mother, every time the child will see the father, he will think that he's going to beat the mom again, or yell again, or scream again, or break things again. So the child will respond to that. There are mood and personality changes that happen, and there's a loss of or reduced capacity to manage emotional states or self-soothe even at that age. There's an increased need for control. Now, this is something that you see a lot with not only children but adolescents who have been traumatized. There's a phrase that I'm trying to think that I read in a book that talked about how children who are traumatized are seeking control, because if they have things in their control, they feel like they're the ones that are controlling, and they can create a safe environment, even though that control means that they are actually causing more problems in the environment. So you see the child will act out behaviorally, will scream, will cause problems. Why? Because the child would rather cause those problems himself than to have somebody else cause them to the child. So that's where you see this increased need for control. There's a fear of separation from the primary caregivers. There's a loss of self-esteem and self-confidence. Confusion about trauma evident in play, magical explanations, unclear understanding of causes and bad events. And there's speech and cognitive or auditory processing delays that also happen between ages 3 and 5. Vulnerable to anniversary reactions set off by seasonal reminders, holidays, and other events. So, for example, if the child was exposed to trauma on his birthday, then every time he has his own birthday, the next birthday, then he might have a reaction, and he might be acting out behaviorally because he may be expecting the same kind of traumatic event to happen again. And there may be memory of intrusive visual images from traumatic event, and that may be recalled in words or in play if you're working with a child, because one of the symptoms of PTSD is, flashbacks and having these visual images from a traumatic event. At the older end of this range, children are more likely to have lasting, accurate verbal and pictorial memory of the central events of the trauma. So about age 5 is when you can ask the question to the child, have you ever seen your parents fight one another? Or, have you ever been in an event where you felt really stressed out or scared? And you may be able to get a better response at this age compared to the ages before. So now we're going to ages 5 to 7. There are behavioral changes, as I mentioned, increased tension, irritability, reactivity, and inability to relax. So you see some of the hyperactivity and anxiety that comes out. So clinicians will sometimes associate their symptoms with something like attention deficit hyperactivity disorder, whereas it may just be an experience, a traumatic experience that the child is reacting to. Sleep disturbances, nightmares that are more prominent now, difficulty falling or staying asleep is also prominent at that age, and regression of behaviors. For those who don't know, regression means when a person basically goes back at developmental level. So they were going forward in their development, but all of a sudden they start going backwards, and that kind of indicates a traumatic event. And the lack of eye contact, which is something that very evident. The person is very easily distracted, so they're kind of spaced out, or they may be hyperactive and they're constantly in motion. Toileting accidents may happen, like enuresis or smearing of feces on wall or on other areas of the room. And we're talking about this happening at a more constant basis, not once in a while. That's something that a child will they normally do because they're so curious. Bodily aches and pains. So now the child is beginning to somaticize their psychological problems. Accident proneness. The child may become more clumsy. May hit into walls or kind of like fall very often and whatnot. And eating disturbances as well. There may be some kind of absenteeism or truancy from school. The child doesn't want to go to school or is going but not attending all of the school. Some kids in very extreme reaction may begin to light things on fire or even hurt animals, and that's a very big red flag for trauma. There's anxiety, fearfulness, and the loss of self-esteem. There's specific fears that may begin to emerge. So, for example, if the child was exposed to say an accident and they were exposed to, say, the ambulance picking them and taking them to the hospital, they might now have specific fear to ambulances or the sirens or the lights or even police officers that kind of indicate PTSD. Efforts to distance from the feelings of shame, guilt, humiliation, and reduced capacity to feel emotions is another prominent feature. A child may feel numb or apathetic, like their loss of emotions. They may just, again, be frozen, and that may be due to because they're getting re-traumatized again. Or even in their mind, they're getting re-traumatized, but now they're kind of responding in that fight or freeze response. They may be vulnerable to anniversary reactions, as I mentioned before. There may be some kind of withdrawn or depressed affect. So this is where you kind of get to see depressive symptoms coming out, like not being able to fall asleep, not being able to get up, sad, crying, and having depressed affect. Blanking out or loss of concentration, and it can happen at any time, whether they're under any kind of stress at school or even normally because they're having flashbacks. Explicit, aggressive, exploitive, sexualized relating engagement with other children. Especially true for those kids who had a sexual trauma to them. If they were sexually abused, they're more likely to portray those same sexual behaviors at an age where you would think that they would not know anything about that. And especially even sometimes toward adults. You may also see sexualized drawing that may happen due to the trauma. Verbally describing the experiencing of sexual abuse, pointing to body parts and telling about the game that they played, or if that's how it was described to them by the adult who was sexually abusing them. There may be excessive concern or preoccupation with private parts, adult sexual behaviors, verbal or behavior indications of age-inappropriate knowledge of adult sexual behaviors. So again, what we're looking for is age-appropriateness. Now, unfortunately, nowadays, because of internet, children can be exposed to these sexual concepts very early in life. However, if you know that you have been shielding the child and there's no way that the child will be exposed, but the child is still portraying some very, advanced sexual behaviors, then that may be indicative of sexual trauma. So now ages 7 to 9, again, changing the behavior, hyperactivity, a lot of these are pretty same. And at this age, if you're seeing the child is bedwetting or defecating in the bed or even outside, that's something that's not normal at all and something to watch out for. Eating disturbances, concentration, memory. Again, a lot of these are symptoms that I've already talked about, so just something to be mindful of. Acting out the traumatic experience and risk-taking behaviors as well. Slight introdriven activity or retreat from others to manage inner turmoil. So they may either go into a hyper mode or freeze out and stop having any kind of reaction. Can anybody hear me? Somebody's complaining there's no sound. Okay, alhamdulillah. So most people are able to hear me. Mood or personality changes, loss of or reduced capacity to manage emotional states. Again, these are symptoms that I've talked about before that kind of go on throughout their life. Increased self-focusing and withdrawal. So now the child is kind of growing into, coming close to their maturity age, and there's more focus on, instead of behaviorally acting out, they might be internalizing and focusing and withdrawing from others. There may be a concern about personal responsibility. So this is where the child, so let's say the parents fought one another, and not because of the child, but the child begins to personalize this and say, oh, it may be because of me. It may be because of something that I did that's causing the problems between mom and dad, and then that may cause the child to go into depression. Wishing for revenge and action-oriented response to the trauma, that may also happen in some children, and that's where the behavioral problems come from. May experience acute distress encountering any reminder of the trauma. So anytime they're reminded of anything, whether it's a smell or touch or feel or anything that they're seeing or hearing, if they're being re-traumatized by that. Lower self-esteem, increased anxiety or depression, fearful of closeness and love. They're likely to have detailed long-term sensory and memory for traumatic events. Sometimes the memory is fragmented or repressed at this age. If you look at the theory of development by Sigmund Freud, he talks about this age is where the age of latency, and a lot of the older memories are repressed to begin with, and if the memory is traumatic, then there's more likely that they're going to repress the memory. There may be speech and cognitive delays as well. Factual, accurate memory may be embellished by elements of fear or wish. Perception of duration may be distorted. Intrusion of unwanted visual images and traumatic reactions disrupt concentration and anxiety, often without the parent's awareness. And these kids become vulnerable to flashbacks of recall and anniversary reactions to the reminders of the traumatic experience. Okay, so I want to finish. So this is basically the the last few slides here that we're going through. The question is, what can you do? First of all, make sure the abuse or the other trauma has stopped. So when I work with parents, one of the first things I talk to them about is, if you're fighting in front of the kids, even if you're having severe marital problems, do not fight in front of the children. If you have to go outside and fight, if you can't control the fighting, that's fine. We'll work on that. That's secondary for me. But my first concern is the child. That do not fight in front of the child. If you have to fight, find a time when the child is in school or elsewhere. Set up a time when you need to fight one another, but try to control that as much as possible because of the traumatic effect. Begin to build a relationship by being honest, reliable, doing what you say you will do. So having that consistency in parenting and not betraying the child's trust. Understanding trauma, knowing what is considered trauma and also how to deal with it properly. Helping the child feel safe through nurture, structure, and support. As parents, that's something we're supposed to provide. But a lot of times, parents are not educated and they're just not fully aware. Using boundaries and logical consequences. If there's a consistency and if there's logic in the consequences, especially at a later age, the child will be able to understand, why that happened, instead of, trying to think that the parents are being unfair to me. Staying calm and well-regulated, even as you set limits on aggression to avoid power battles. So especially if the child has been traumatized before, and you may speak in a loud voice just to make a point, and you're not yelling at the child, but you may be re-traumatizing the child, because in the child's mind, loud voice means that this is a trauma or this is a fight. So just kind of being aware of that and to avoid any kind of power issues. As I mentioned earlier, children may have issues with control because of their trauma. Understanding your own traumas so you can reflect on your own feelings and reactions so you don't pass on that intergenerational trauma. Co-regulating with the child, use your calm to soothe and help them calm as well, inshallah. Don't take their behavior personally. Again, it's not about you. It's not because they don't like you and whatnot. It's because they have been traumatized and this is what they've learned through their traumatic experiencing. Using discipline without shaming. So again, I'm not against disciplining. I'm not against spanking, but if that's causing a traumatic experience to emerge with a child, then you have crossed the line between disciplining, and physical abuse. And in any case, never shame the child. If you have to discipline, do it when nobody's watching. Do it in a way so the child doesn't feel any kind of shame. And also engage with family members and other caretakers, because it's important for everybody to be on the same page, inshallah. So these are the references that I used, if anybody wants to look them up. So I think at this point, if there are any questions, inshallah, we'll try to answer to the best of my ability. Jazakallah khair. Okay, this is that question. Does a lack of social interactions affect the development of a child's brain and the interactions with outsiders? Absolutely. Now, alhamdulillah, Allah subhanahu wa ta'ala has created us as social beings. Two people have to come together for us to even exist in this world. So if the child is shielded from those social interactions, now obviously you have to draw the line. If the social interactions mean that the child is going to be exposed to trauma, so then it may be better for you to shield them. But however, if the child is being shielded from normal social interactions, like playing with outside with other children, or having the fun that they're supposed to have, then yes, it will have a negative effect. Now, on the other hand, if you're afraid that the environment is not safe for the child, I would recommend that you try to have the same type of fun, the social environment, create that inside the house, so the child doesn't feel neglected or not being properly taken care of. If a mother from the time of pregnancy after delivery goes through difficulties and and a very sad life, will it affect the child? If so, how can one bring back child to normal? She's always moody and negative. So one of the things that happens with mothers, obviously, is that they may have postpartum depression, and postpartum depression can cause this kind of a negative relationship to form between the child and between the mother. So it's something to be very mindful of, because it's something that can negatively affect, especially if the first few years are supposed to be about trust, and if the trust is not being formed. I would say always self-care. This is hopefully, inshallah, there's a father that can take on some responsibilities, but always take care of yourself, because if a person is feeling depressed and not able to regulate their own emotion, there's a higher tendency for you to act out. And this is where you see moms hitting their 1-year-old, slapping them. And they're just babies and they don't know what they're doing. But the mom is not able to control themselves and regulate. So please take care of your own self and see a counselor therapist if possible, and take care of that before you move on to the child. I had to deal with a mother who would not take any kind of medication for her depression because she didn't want to stop breastfeeding her baby. And I had to really teach her that, at the end of the day, your depression is causing a lot of negative effects to take place here. Just to be mindful of that, that it can cause some negative effects to happen. The next question here is, what is the effect to the child if mother had bad experiences like husband abuse during pregnancy? During pregnancy, if there's any kind of epigenetic issues, for example, physically, if the mother was beaten and the child's development, like the fetus development, was somehow damaged, then there could be negative effect. I'm not fully aware of any research on whether like the yelling and screaming, because there is research on the baby is able to hear at a certain time. I'm not aware if the yelling and screaming can be heard by the fetus and that causes any kind of issue. But obviously, physically, it can affect. But also to remember, if the mom is depressed and it's because of the abuse, and now there's a higher level of hormones inside the mother's body, that may also get passed on to the child when delivered. So to be mindful of that, inshallah. Should you let the child ask any questions without guiding him to a proper question? I would say yes. If the child is asking you a question, it's better to let them ask, because you have to remember, if you don't let them ask, they're going to go elsewhere and they're going to look for a response from somewhere else. So if you have to ask, if you have to listen and sit there and try to guide their response, that's better. But if you try to ignore it altogether, that may not be a proper way to handle it. How do you deal with children who have been physically abused and have cut something with their caregiver, or have cut ties with their caregivers? That's a very complicated issue to deal with. I think the way you deal with trauma is, there's a lot of research on cognitive behavioral therapy. There's a lot of research on exposure response, prevention therapy. and also even play therapy, just trying to develop that relationship with them. If they've missed out on any kind of opportunity as a child, to see if they're able to do that with you as a therapist. Like, for example, building trust. If they weren't able to build trust with their caregivers, it's going to be difficult, but one of the first things that I will do is try to begin building trust with them in the therapy. And so if you're the caregiver, that's something maybe you can do. Can child trauma at early age induce severe multiple personality disorder? How can a victim recover from it? I'm not sure about the, if you're referring to the multiple identity disorder, like the dissociative identity disorder, I'm not aware of any research if that's something that happens. But obviously it does affect the personality negatively, and so it may cause problems in their personality if they're exposed to trauma. How do you undo effects of trauma on their children? Again, through some kind of proper structured therapy. You could do some kind of small exposure and help them relax. Remember that PTSD is an anxiety disorder. And it's categorized under anxiety, the umbrella of anxiety. So the underlying issue is always anxiety. So help the child to relax. Understand them. Understand that they're going to be aroused. Understand their reaction, but help them relax. And that is going to, inshallah, help them as well. What do you do if the mother tells the child that they are cause of the mother's depression and sad life? Then you have to work with the mother. I mean, if the mother is not able to understand, that it's not the child's fault, then the mother is going through her own deep mood issues, and that's something that I feel that you have to first deal with them before you deal with the children. I'm going to leave my contact information on here, so if anybody has any questions, feel free to contact me, and inshallah I will try to answer as much as I can. Also visit the Khalil Center website, where I'm the deputy director at, and if you have any questions, you can also contact me through there, inshallah. So with that, I conclude. Jazakallah khair. Wa akhiru da'wana alhamdulillahi rabbil alameen. Sallallahu ala nabiyyi wa alihi wa sahbihi wa sallam. Wassalamu alaikum wa rahmatullahi wa barakatuh.